Hi, I'm Eric Schaefer. I'm in BSN 225, Section 11. Today we're going to be demonstrating the administration of an intradermal injection. So today we have an order for our patient, Mr. Smith. He has an order to do a PPD test with the administration of an intradermal injection of tuberculin protein. So the order states that we're going to be giving our patient, Mr. Smith, 0.1 mLs of tuberculin protein via an intradermal injection. So we received our order. We want to verify our order with 6 rights. So we're checking for right patient, right medication, right dose, right route, right time, and then, of course, the right documentation. So we're going to go ahead and verify our order in the MAR, and then we're going to go ahead and gather up our supplies. So I've gathered up our supplies. We've got our supplies here. We've got our vial of tuberculin protein. We've gathered the right syringe that we're going to be using, which is going to be a tuberculin syringe. We have a set of clean gloves. We have hand sanitizer to apply hand hygiene. We have gauze for after we give our injection. And we have alcohol so that we may clean our vial prior to drawing our medication, and so that we may clean the site prior to administering our injection. So we've gathered our supplies. We're going to go ahead and take everything, and we're going to go over to our patient's room. So we're going to knock on the door. Hi, Mr. Smith. I'm Eric. I'm your nurse. I'm here to give you your PPD test. Is it okay if I come in? So the patient has given us permission to come in. We're going to enter the room. We're going to go ahead and close the door behind us for privacy. Once we've entered our room and closed the door for privacy, we want to verify the patient. So we're going to ask the patient to state their full name and date of birth, and then we're going to verify that with their armband. Once we've verified that the patient is the correct patient, we're going to ask the patient if they have any allergies. So, Mr. Smith, do you have any allergies to medications, food, seasonal allergies, or any other allergies that we should know about? The patient states that he has no allergies, so we're okay to proceed. So at this time, I'm going to go ahead and explain to Mr. Smith the procedure that we're doing. So we're administering an intradermal injection. The injection is of a tuberculin protein. It's for a PPD test. It's going to be done intradermally, and the dose is going to be 0.1 mLs. The reason for this test is to determine if there's a positive or negative reaction to tuberculosis being present. So that is the reason why we're performing this test. Side effects to the injection could involve redness or irritation of the skin. It could involve bleeding after the injection. It can involve bruising after the injection. We do want to note and point out to the patient that there may be, with the injection, there may be some burning or stinging present when we give the injection, that this is normal and this will go away. We also want to discuss with the patient adverse effects to this medication. So adverse effects to this medication will could involve swelling of the hands and face, difficulty breathing, so along the lines of allergic reaction. So if the patient experiences any of these symptoms, we want to inform them to notify us or the doctor immediately, or if necessary, call 911 or go to their nearest ER. After that, we're going to ask the patient if he has any questions. So, Mr. Smith, do you have any questions? The patient doesn't have any questions, so we're going to go ahead and proceed. So at this time, we're going to go ahead and draw up our medication. Again, we're going to go ahead and check our MAR. We want to verify that we have the right orders. So we have our tuberculin protein. We're giving that at 0.1 mLs. We're going to go ahead and apply hand hygiene. So I'm going to go ahead and use a hand sanitizer. I'm going to go ahead and put on clean gloves. And then we're going to drop our medication. So to do this, we want to remove the cap from our vial. We're going to dispose of the cap in the trash. I want to take an alcohol pad, and I want to thoroughly clean the top of my vial by scrubbing the top of the vial. I'm going to set that aside to dry. I'm going to then take the tuberculin syringe and I'm going to open the package. I'm going to remove my tuberculin syringe. I want to notice the point where we're going to draw the medication, which is going to be 0.1 mLs. I'm going to pull back on the plunger until I am at 0.1 mLs. So if you can see, at 0.1, we're going to go ahead and remove the cap. And we're going to go ahead and insert the needle into the vial. And we're going to expel the air, the 0.1 ml of air. We're going to go ahead and invert our vial. And we're going to pull back on the plunger until we are at 0.1 ml. We will then remove the needle from the bottle. We will check our syringe for air. We will flick that air to the top and reposition our plunger. Okay, so we have 0.1 ml of the tuberculin protein. We are then going to administer the intradermal injection. So we're going to go ahead and assess our patient's forearm. We're going to try to use the anterior portion of the forearm if possible. So we're going to do this. We're going to assess it. We want to palpate it for any tenderness. We're going to notate any abnormalities, any lesions, any bruising, any discoloration. And when we select our site, we want to do this by selecting 3 to 4 finger widths below the antecubital space and 1 hand width above the wrist. So we've selected our site. We're going to go ahead and we're going to clean the area. We're going to do this with an alcohol wipe. We want to scrub the site with a circular motion. We're going to scrub in a fashion by rubbing circular from the inside out. And we want to clean approximately 2 inches of space. We're going to go ahead and dispose of our alcohol wipe, and we're going to allow our site to dry. We're not going to blow on it or fan it, and we're not going to touch the site. We're just going to allow it to just sit and dry. Once our site is dry, we're going to take our needle. We want to position it bevel up. We want to grasp it, holding it with our forefinger and our thumb. We want to position our patient's arm, and we want to pull the skin with our forefinger and thumb where we're going to administer our injection. We want to insert our needle at a 5 to 15 degree angle. We're going to insert our needle slowly, advancing it approximately 3 millimeters under the skin, looking to see the presence of that needle. Once we are in, we want to feel slight resistance. We're going to grasp the top of the syringe and hold that in position with our non-dominant hand, and we will slowly inject our medication. We want to notice a small 3 to 6 millimeter bleb forming at the injection site. It should resemble a mosquito bite. We will then remove our needle. We will engage our safety device, and we will dispose of our needle into a sharps container that I have at my side. If there is any blood, we will simply dab that away. We will not massage the area. We will then ask our patient if they have any questions. If they do not, we will go ahead and remove our gloves. We will dispose of them in the biohazard container. We will apply hand hygiene. We will ask the patient if they need anything else, and if they do not, we will excuse ourselves from the room. We will go ahead and close the door for privacy, and we will go ahead and document the procedure.